Good afternoon, Ernest Neal. Let's begin the warm-up session. What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education, and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship, that is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
Importance of communication in nursing.
Communication in nursing is the exchange of information, thoughts, or feelings between nurses and patients, as well as among nurses and other healthcare professionals. Communication is important in nursing because it facilitates the delivery of quality care, and builds trust and rapport. Communication also helps nurses to ensure patient safety, by verifying information, reporting changes, and following protocols.
How to communicate with patients effectively.
To communicate with a patient effectively, you should greet the patient with a smile and their name. This helps to create a positive and respectful first impression and shows that you care about the patient as a person. Take your time, even if you're in a rush. This helps to convey that you are interested and attentive to the patient and that you value their time and input. Try to avoid distractions, interruptions, or multitasking while communicating with the patient. Importantly, explain things as simply as you can. This helps to ensure that the patient understands what you are saying, and avoids confusion or misunderstanding. Use plain language, avoid medical jargon or acronyms, and give examples or analogies when possible. Finally, ask your patients if they understand everything to check for comprehension and clarify any doubts or questions.
What is the dignity of being a nurse?
Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. One of the dignities of being a nurse is respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy, and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession.
What are the skills I need to be a nurse?
To be a nurse, you need a combination of both hard skills and soft skills. Hard skills are those that are learned through training, education, or certification. Soft skills are habits or traits that enable you to work well with others. Hard skills can be acquired through formal education, such as a diploma, associate degree, or bachelor's degree in nursing, and certification or licensure exams. Soft skills include interpersonal and communication skills that are vital for building rapport and trust with patients and colleagues and can be developed through experience, feedback, reflection, and self-improvement. However, depending on the specialty, setting, and role, one may need additional or specific skills to excel in the nursing career.
Your preparation time is over. Please start your OET speaking role play.
Good morning, Mihiraa. I hope you're feeling as comfortable as possible today. It's Ernest, your nurse. I've come by to check on how you're doing after your hip replacement surgery and to discuss some important steps in your recovery. Let's make sure we're on the same page and address any concerns you have about your progress. To begin, can you tell me how you're feeling today?
Oh, Nurse Ernest, I do feel some pain, especially when I try to move. It makes me hesitant to even think about exercising. I don't feel confident at all.
I completely understand how you're feeling, Mihiraa. Recovering from surgery can be an overwhelming experience, and it's absolutely natural to feel hesitant, especially when pain is making every movement feel difficult. I want you to know that you're not alone in this journey. We, as your healthcare team, are here to guide and support you every step of the way. You don't have to face these challenges on your own. The reason I'm encouraging movement and gentle mobilization is because it's truly one of the most important aspects of your recovery. Staying inactive for too long after surgery can unfortunately lead to complications, such as blood clots, stiffness, or slower healing. These are things we can help prevent together by introducing small, manageable movements into your routine. Even light activity improves blood circulation to your surgical site, which helps your body heal more efficiently. Beyond the physical benefits, gentle mobilization can significantly impact your overall recovery experience. It can help you regain your strength and confidence while also making you more comfortable as you adjust to moving again. Plus, the more proactive we are now, the sooner you'll be able to regain your independence, which I'm sure is something you're looking forward to. It might also mean you can leave the hospital sooner, as your recovery progresses while here under supervised care. Mihiraa, I know it can feel like a big step, so please tell me, what's making you feel most uncertain about starting to move right now? Are there specific worries or concerns that are weighing on your mind?
I'm really scared of falling. It would be so painful if I fall, and I feel like I need more time. Maybe I'll start after I get discharged.
It's completely natural to feel that way, Mihiraa. Facing the idea of moving after surgery can be intimidating, and you're not alone in feeling this way. Many patients share similar worries. But I want to reassure you that every step you take during your recovery will be carefully planned, safe, and fully supported. You won't have to do this on your own. Either a physical therapist or a member of our staff will be with you at every stage, ensuring your safety and guiding you through each movement. We'll also use supportive equipment like walkers or rails to give you added stability and confidence as you begin. We understand how important it is to move at your own pace, so we'll take things one step at a time. There's no need to rush. For example, we might start with something as simple as sitting upright in your bed to help your body adjust, then progress to standing with assistance, and eventually taking small, supported steps. These small, achievable goals are designed not only to help you recover physically but also to rebuild your confidence in your ability to move safely. Mihiraa, I hope this gradual and fully supported approach helps ease your worries. You are in a safe and caring environment where we're here to help you succeed. Does this make you feel more assured about starting some gentle movement? Let me know how you're feeling about this plan. I'm here to listen and adjust as needed.
Well, nurse, I think I'll just rest here in the hospital and get a full recovery. Once I'm discharged, I'll start exercising and moving around at home.
I hear you, Mihiraa, and I completely understand your desire to focus on rest right now. Rest is certainly a vital part of your recovery, and feeling well rested can make a big difference. However, I'd like to gently share why starting some gentle movement while you're still here in the hospital can be incredibly beneficial. Here, you have access to round-the-clock care from a dedicated medical team, who are always available to assist you and ensure your safety. We also have physiotherapy equipment and trained staff who can guide you through exercises tailored to your needs. If anything feels uncomfortable or challenging, we can adjust immediately to make it work for you. When you're at home, it may be harder to access this kind of support and equipment, and that could slow down your progress in regaining strength and mobility. That said, your comfort and readiness are our priorities. If the idea of walking feels too overwhelming right now, we can take a different approach. Simple bed exercises or chair-based activities can still make a big difference in keeping your blood circulation healthy and preventing your muscles from becoming stiff or weak. These small steps can also make it easier for you to transition to more active exercises when you're ready. How does that sound to you?
That sounds more doable. I think I can manage that, and it's reassuring to know I won't fall. I'll give it a try.
That's wonderful to hear, Mihiraa. I'll work with the doctor and the physical therapy team to develop a personalized care plan tailored to your needs and pace. I'll also ensure you're fully supported throughout. For now, let's proceed with some clinical observations to guide our next steps. Does that sound all right?
Yes, that sounds fine. Let's do it.
Great. Let's get started.